The broadcast is now starting. All attendees are in listen-only mode.
Well, good afternoon, everybody. Welcome to the COVID-19 Stop the Spread, a way to help ag businesses in Washington State learn how to prevent the future spread of the virus in your workplaces. My name is Rick Gastelum. I'm the CFO for the Washington Farm Bureau and also the leader of our Farm Bureau Solutions products and services that you've probably been seeing rolling out recently. Thank you for all of you that are in attendance to this webinar. We felt it was important to put out some information to help educate you on what we're hearing, what our staff is hearing from sort of government recommendations and guidance, and just based across the 100 or year or so of experience that our staff, that our safety and health staff have that work with our retro program. We felt it was imperative that they help get some information in your hands to help guide you through what you can be doing in your business during these very difficult times, as well as ever-changing times. So with that, just a couple of housekeeping things. As a part of this webinar, in your webinar menu, down to the bottom right, you'll see a section called Handouts. Notice it says there are 5 of 5 handouts available. Those are for you to take. I recommend you download them before the webinar is over, and there will be some great resources that our staff will be walking you through as the presentation goes along. Last little note, any question that you have, we're going to have all the mics muted for the attendees, but if you have questions, please submit them in the question box. We'll be monitoring that during the webinar, and if there are some common themes of questions, I will introduce those to the presenters, and if we don't get to your question during the webinar, somebody from our team will get back to you after the webinar and help you get that answered. With that, I would like to turn it over to our team of Dominique Damien, Corwin Fisher, and Richard Klein, and they can introduce themselves and get this kicked off.
Thank you, Rick. Hello, good afternoon. I'm Corwin Fisher, Safety Director with the Washington Farm Bureau. Right now, we would like to take this time to Washington Farm Bureau to take this time to thank all agriculture and ag-related employers and employees for providing safe and healthful food for the American people. It is you working the front lines, growing, processing, packing, trucking, and all the other tasks that we depend on to feed our families and the world. We're so grateful for you for the work you do. You are the real heroes to keep the food chain in place. Agriculture and ag-related businesses and farms and employees are vital when it comes to beating COVID-19. Thank you, be well and be safe. Agriculture has been deemed an essential business, and it is. Our nation and world need you to continue feeding us all. However, you can't keep operating your business as usual, as we have found out. While operating your essential business, you need to make changes to how you operate and do your part to help stop the spread of COVID-19. The Washington Farm Bureau Safety and Claims team will help educate you on the best practices to help stop the spread of your business, in your business. Your Safety and Claims team, myself, Dominique Damien, and Richard Klein will present the following. In a time when the government is recommending telecommuting to work, what are the agricultural employers supposed to do? Knowledge is power. Understand the SARS, the COVID-2 virus, and COVID-19 illness. Use familiar safety and health methods to protect workers, yourself, and your family at home. When you can't eliminate the virus, ideas and suggestions for administrative controls, and most of all, where to find resources for employers, employees, and families to use now. The objective today, what is a coronavirus? Why is this mutation a crisis? How to protect your employees, and we'll cover some myths that are out there amongst all of us.
Thank you, Corwin. This is Richard Klein, and I am the Director of Safety and Claims for the Washington Farm Bureau. And I'm going to cover some of the information that we do know. And remember, this is changing all the time, so keep reaching best bet. The current concern about coronavirus started with several reports of pneumonia of an unknown etiology in Wuhan, China in December of 2019. Those reports were forwarded to the World Health Organization on December 31st of 2019. Just for some suggestion, Wuhan is a very large city, about 5 times larger than London. So, and it is considered to, most of this information is covering all of Hubei province. So the virus causing the outbreak was early identified as a coronavirus. We'll get to that later, in early January. This is basically through genetic analysis of the infection in early patients. When we talk about a coronavirus, we're talking about a very large family of viruses. Many of them cause cold-like illnesses in people, and the vast majority cause similar illnesses in animals. If you look at those pictures, coronavirus is named for those crown-like spikes that cover all of them. So it's really just a physical manifestation. As with most viruses, coronaviruses are very small, 120 nanometers, 0.12 microns, or 12/10,000ths of a millimeter. So that's how small they are. And we'll talk about how you can protect against that later. Human coronaviruses were first identified in the mid-1960s and presumably been causing things long before that, but we've only known about what they were since the 1960s. And there are 4 subgroups of coronaviruses. There's alpha, beta, gamma, and delta. Most of the human infection from coronavirus seems to be in alpha and beta. This novel coronavirus, or SARS-CoV-2, we don't know whether it's alpha, beta, or even something else because they haven't done enough testing on it yet. Within the human coronavirus types, there is differentiation within those subgroups. 7 of them that we're talking about can infect humans. We're only talking about 7, used to be 6. So it's possible, but it's rare for coronaviruses that infect animals to evolve and make people sick and then become a human coronavirus. 3 examples of this are SARS-CoV, MERS-CoV, and SARS-CoV-2, or the coronavirus that causes COVID-19. The SARS-CoV-2 virus is named for its similarities to the SARS virus, which caused, as we all recall, Chinese infection, started infection based several years ago, SARS. And it's the one, the CoV-2 is the one causing the current coronavirus disease 2019, or COVID-19. It's suspected that this particular coronavirus mutation has a spillover from one that infects animals, specifically fruit bats in China. However, the exact source is still unknown. It is very unlikely that it emerged from a lab or any other testing simply because of the nature of the mix within the DNA of the coronavirus. It just wouldn't happen this way if it had been from CRISPR or any of the other issues that we sometimes hear about. One thing that I think is important to document at this point, even though there is a spillover from animals, and even though the zoo in New York now has a tiger, maybe a couple of tigers, with some version of SARS-CoV-2, there is no evidence that companion animals or agricultural animals, cattle, livestock, can spread COVID-19, or beyond the tigers and felines, can become ill because of it. It's still cautioned that you limit your contact with some animals, but that is largely an issue of it's hard to sanitize a pig. So if you cough on the pig and it happens, we just can't do that. However, if you have older folks, people with compromised immune systems, anyone else who lives primarily indoors, whether that's inside of a nursing home or inside of your home that they don't go out much, and they have access to animals that don't have restrictions on how they come and go, certainly try to limit that sort of contact. That's when people say limiting contact, we're looking at the people who are at highest risks, not that animals are at risk. This is a timeline just in general to give you an idea of through current. The first case reported in the US was on January 22nd, 2020. So up until April 5th, 2020, the CDC has reported 330,891 confirmed cases in the United States. It's just in the United States alone in less than 3 months. Some earlier reports may be misleading due to the lack of testing. There's no denying how quickly this is spreading. And remember that we haven't had consistent nationwide testing still. Our testing capabilities are limited, so therefore things such as how infectious it is in the US, what the illness, infection rate, the death rate, all of those are really guesstimates until we have much better testing and much better reporting of information from across all 50 states. As of today, around the world, there are 1,214,973 confirmed cases, and that's in over 203 countries. So on every continent, with the exception of Antarctica. Because we're still learning things about a disease that we didn't know anything about 6 months ago, contributing to this current crisis is the fact that this is a novel coronavirus or a brand new disease. The CDC continues to update their website with the most up-to-date information, and they add that disclaimer across the top there to every page they have regarding the COVID-19 outbreak. I want to reiterate that you're going to see that everywhere. That doesn't mean you should discount what information is there. It's just that more information is still coming in. We're still learning about how the virus spreads, but they are saying that it seems to spread easily and sustainably across communities. At this point, it is a community-based illness, which means like the flu or the common cold or the measles or mumps, it's something that spreads not always as clearly as, oh, I talked to Bob Tuesday at 7 and now I'm sick, so it must be Bob. That's when we say community-based, we mean that it's going to be harder and harder over time to pinpoint exactly where it came from. What we do know, respiratory droplets from an infected person who coughs, sneezes, or even talks makes its way, whether landing or being transported to the mucous membrane of a bystander or an uninfected individual. Currently, the agreed upon safe distance to avoid an infective cough or sneeze is 6 feet, which is about the distance that they think the droplets from a sneeze would carry. One of the things that to remember is that as of last week, if you're a loud talker, they found that even that will carry sufficient spray to infect a bystander. It is possible to also spread the disease by touching a contaminated surface and then touching your own mucosal membranes. So basically, we all know how often we touch our face, how often we wipe our eyes, how often we wipe our nose with our hands. Don't do it anymore. Probably should never have done it, particularly during cold and flu season, but this is just a very, very serious reminder. It's not thought that this is primary because we do well, but take all precautions. The CDC statement also indicates specifically a significant portion of individuals with coronavirus lacked symptoms. What we have found out is that folks who are infected but are as yet asymptomatic, which means they don't have a dry cough, they don't have a temperature of over 100 degrees, they are not feeling shortness of breath or other manifestations of the disease. Those folks may never show symptoms, may be pre-symptomatic if they do show symptoms, but they can transmit the disease as soon as they are infected. Symptoms don't show up until, on average, 4 to 6 days after infection and as long as 2 weeks after infection. So even if you're looking at somebody who's asymptomatic, you're also dealing with their last 2 weeks. Currently, of course, there is no vaccine or treatment, but lots of studies are ongoing. As with everything else, we'll update you on anything we know. This is some identification of the information that we have, particularly for Washington, but across the United States. COVID-19's outcomes are serious. Serious illness, which means requires hospitalization, happens in about 16% of the cases in China so far. As of March 31st, there have been over 338 deaths in Washington alone, 8,910 deaths in the United States, and those are all attributable to the COVID-19 infection, people who wouldn't have died but for. Across the world, almost 68,000 deaths have been identified through the World Health Organization. This table here is actually through March 16th, and that's one of the things that happens when you're in the midst of an ongoing situation, is that we can only identify information that we had and double-checked a bit ago. So, of the cases reported in each age group here, CDC shows that the percentage of serious outcomes, including hospitalization, ICU admission, and deaths, are largely with people who are 65 years and older, quite seriously with folks who are 85 years and older, but across the board, there have been some hospitalizations, and everything over 19 looks like some deaths as well. One of the things that you want to remember is these are the underlying conditions that even if you're not over 65, you should be concerned about. Any kind of chronic lung disease, asthma, serious heart conditions, diabetes, obesity, kidney disease, liver disease, or any other kind of immunocompromised condition, any kind of immunosuppression. So these are situations that when you look around your family and your friends, make sure that those people are particularly taking precautions. Part of the reason that we say this and we highlight this is the average age of our farming community is 58 years old, much higher than the average age of the population as a whole. We also want to remember that in our rural communities, there are fewer health resources, and we have other concerns that make that potential folks who are at risk a higher percentage than in the population as whole. So not to frighten people, but to make sure, pay attention to what's going on around you. One of the things that you hear a lot about is flattening the curve. And that refers to slowing the rate of infection to allow hospitals to keep up with demand. Now remember, that is slowing the rate of infection. It in and of itself may or may not do anything with the total infections themselves. We're talking about resource and response time being controlled. One of the issues we have is the United States has 2.8 hospital beds per 1,000 people. Again, that's across the board, so rural communities often have fewer than that. If we use Italy, if you've read anything in the papers, they have 3.2 hospital beds per 1,000 people. So they have almost twice as many hospital beds per 1,000. And we look at what their response and results were. So we can hope that we're doing better, but that's the reason why we are taking as many precautions as possible. This is a chart that was developed by Dr. Akiko Iwasaki, who is a professor at the Yale School of Medicine, to make a quick comparison between COVID-19 and some of the other respiratory infections that we are more familiar with. There's a lot of questionable information out there, and we think it's best to have clean, clear, and whatever information we do have, So it's one of the things to remember is that currently the crude mortality rate is between 3 and 4% for COVID-19. The mortality rate for the average seasonal flu is well below 0.1%. Now, that because we don't have really good information on anything other than the number of deaths, we don't know how realistic that death rate is, but currently it is much more virulent than the regular flu. When we compare rates of infection from the 2003 SARS outbreak, which was one of the more contagious forms of the coronavirus, that killed approximately 775 people. According to the CDC, COVID-19 has already killed 247 in Washington state as of March 31st, and approximately 58,000 we're talking about worldwide as of today. So more infectious than most, and probably more deadly than most. That's the portion that we know is true. Everything else is just a guesstimate. And at that point, we will bump this over to Dominique Damien.
Thank you, Richard. So my name is Dominique Damien. I am one of the safety directors here at Farm Bureau, and I'm going to talk about ways to protect your employees from spreading and catching the COVID-19. So how do we protect our employees? This picture is a common safety and health graphic. It's known as the hierarchy of controls. Remember, relying on personal protective equipment is the last line of defense. So starting at the top, the first method of prevention is to eliminate the hazard. Because we don't know who is infected, the only way to eliminate the hazard is to eliminate people in the workplace. Governor Inslee announced a stay-at-home and stay healthy order on March 23rd, 2020 to help mitigate the spread of the coronavirus. This means everyone in Washington is required to stay home unless they need to pursue an essential activity until the morning of May 5th. He stated, "The less time we spend in public, the more lives we will save." So now is the time to get creative and foster any potential ideas for employees to work from home. However, we know most agriculture jobs do not have the capability for telecommunications. Although anecdotally, we have heard at least one farm mechanic working from home. The following slides will provide some ideas and suggestions for protection of employees who must continue to work in a shared workplace. To start, we suggest conducting a hazard assessment to identify areas of potentially high exposure and then mitigate those exposures. We have attached a few handouts to this presentation, and one of the handouts is going to be the OSHA guidance for workplace controls. Whoops, I can't seem to bring that up. So if you looked in the handout section of this webinar, it is available there. It goes through some of the guidance that we're going to talk about. It also goes through how to classify employees as higher risk exposure. They tend to classify agriculture as a low risk industry, but we still have to take precautions for anybody that's going to be working in a shared workspace. So there is not a ton of opportunity for elimination or substitution controls. So we're going to continue down the hierarchy and move on to engineering controls. Knowing that the virus most commonly spreads through droplets of materials from an infected person to another, sneeze guards can help block those droplets. You might have seen these pop up at some of your local grocery stores. This might be an opportunity for you. It might help prevent infected material from spreading to other nearby employees. Another option may be to increase ventilation in shared workspaces and install high efficiency air filters. If you do develop other engineering opportunities, please share with your neighbors and us so we can help all of our members stay safe and working. The majority of our recommendations have been in the way of administrative controls, and these pictures demonstrate the difference between engineering controls, where you keep the hazard from the employee, and administrative controls, where you are relying on the employees to stay away from the hazard, which is each other. So the first step, as any safety and health guidance we're going to give you, is to add it to your accident prevention program. During this time, you should modify your accident prevention program to reflect the hazard assessment that you complete. If these changes are temporary, include the dates that they will be effective, which can be modified later. Actually, the entire policy can be modified as more information becomes available. We also included in the handouts a sample addendum to your current accident prevention program. Feel free to use this and modify it for your company. The first part would also be to identify non-essential tasks that may cause exposure and may be omitted during this period of time. Your hazard assessment can help you identify any standard operating procedures that may need to change and new ones that may need to be implemented. With these changes, keep in mind that staff will need additional training to perform the tasks safely. While reviewing and modifying your accident prevention program, keep in mind you should be establishing protocols to limit person-to-person contact, restrict movement from farm to farm, and routinely disinfect high-touch areas. You want to restrict shared tools and equipment as much as possible, and encourage employees to report illnesses. And then, of course, we want to train employees. And we'll talk more about each of those later. Employee training. So you have to train employees on any new protocols that may affect them. Ensure that safety and health training is included in all new protocols. If the employee will be working with any new chemicals to disinfect work areas, ensure that they receive chemical hazard communication training. If employees will now wear respirators, ensure they receive respiratory protection training. Train employees on how the virus spreads and how employees can protect themselves. The best method would be physical distancing, which is to stay 6 feet from one another. Train employees on how to wash their hands frequently and for at least 20 seconds with soap and water. And if soap and water is not available, they can use hand sanitizer with at least 60% alcohol. Teach employees to avoid touching their faces. I think that has been highlighted. Everybody's much more aware of how much we touch our faces, and it's something that they may need to be reminded of. Cover all coughs and sneezes, and then discard tissues in the trash can. But more importantly, encourage employees to stay home if they are sick or they have been in contact with anyone who is. Yeah, we know that labor is short already, and encouraging employees not to come to work puts you in a bind. However, missing a few employees for a short period of time is better than shutting down because the majority of the workforce has contracted COVID-19. If possible, you may want to encourage your higher risk employees, 65 plus, to stay home preemptively. High schoolers may be able to fill in some of these positions for the time being. However, if you do hire minors at this time, please contact us first and we can walk you through some of the logistics that go along with that. Have supervisors ask employees prior to their shift if they or someone they have been in contact with have either a fever or coughs, aches, any trouble breathing. You may need to evaluate your sick leave policy. Concern might be for the financial obligation for people to come to work even if they are sick. And to alleviate some of that, you might want to assist employees with the sick leave and unemployment benefits they may be entitled to. With that, document their hours and the reason for their layoff or leave that they use. Document that it's due to the COVID-19. If they use unemployment benefits for COVID-related reasons, Employment Security will not count this against your rates. And we're keeping up with the most up-to-date information, and these resources are available at our website, which is down there at the bottom of the screen. And then emphasize to your employees why their participation is so important. These guidelines are conditions that must be followed. Not following these guidelines may be considered an arrestable offense. So make sure you're using your disciplinary policy along with that. A lot of the culture within agriculture, or a lot of the culture within the agriculture community is to come to the workplace because work needs to be done. So it's important for employees to understand how important it is for them to stay home if they're not feeling well. And then just communicate updates as often as you can. Again, attached to this presentation with some handouts, we have a safety meeting regarding COVID-19, and that's in English and Spanish attached to this. It's also on our website, as well as some CDC fact sheets and posters that you can put up in your workplace. So, physical distancing, also known as social distancing. They've tended to change it, the terminology, to physical distancing because we're not supposed to be just socially distancing, but actually staying away from people physically. So this might be the most effective control to implement. It may also be the most challenging. So here are some ideas to make it possible to allow at least 6 feet of distance between employees. You might need to change your work schedules. You may need to adjust hours or add shifts so there are not as many people in the work area at the same time, and you can space out things like the packing line. If you have morning meetings or any meetings to divide up tasks, allow them to be done via telephone or some other digital method. Conduct safety meetings using technology like Harvest, which if you came to any of our winter workshops, you saw the owners of Harvest present on. It's a platform, online platform that allows employees to listen to safety meetings in English or Spanish through their own personal electronic devices. You can find out more about this by visiting Harvest, which is HARBUST.com. They have our latest safety meeting topic page about COVID-19 on there as well. Staggering breaks and lunches. So the lunchroom is not as crowded and allows at least 6 feet of distance between people. You might need to remove chairs and tape designated areas that are 6 feet apart within the lunchroom. You might encourage employees to take lunch in personal vehicles alone. Don't allow more than one person to be in the vehicle at a time. And as far as transportation, maybe make multiple trips to transport employees. If you provide transportation to and from work sites, plan to make multiple trips to limit the number of employees in the vehicle at a time, and then disinfect the vehicle before and after each trip. Avoiding contamination. First of all, we want to discourage sharing of common work items, so personal protective equipment, telephones, computer keyboards, desks, office supplies like pens, tools and equipment. If you don't already, you should have a procedure for disinfecting workspaces and employer provided housing regularly, more often than usual. You may even need to implement a new position or team to do this. Workspaces to include in your disinfecting procedures should include all high touch areas like bathrooms, break rooms, doorknobs, computers, keyboards, any shared equipment like forklifts and pallet jacks, ladders, trucks, ATVs, and rolling stock. And then of course, any employee housing and transportation. Employee housing should be disinfected at least daily, and other areas may need to be disinfected even more often. There is an EPA list of approved products that will protect against human coronaviruses. On this list is a contact time needed for the product to be effective. Ensure your procedures include that information. And this will be on our website if it's not already. You can find the list of EPA approved products. Next up, limit access. So it is important to limit access to your workplace right now. You can define who is and who is not considered essential staff that limit access for any non-essential people and visitors, including visitors. There are a few reasons why a person's not in your workplace should be in your workplace. You might need to develop a policy on how and when to deny access, include the duration of this policy, and train employees on this policy. Then you might need to consider contract work. If it is something that can be performed by your employees, can you now implement that? And then lastly, we're going to talk about personal protective equipment, or PPE. Remember, this is the last line of defense. If you cannot prevent exposure in any other of the previous ways, ensure you provide PPE to your employees. Gloves will help people in between periods of disinfecting and hand washing. Respirators with N95 filters and better can protect against the virus. They are rated for 95% protection against particles 0.3 microns because that is the most penetrable size. They protect against particles larger or smaller even better. So particles smaller, like the coronavirus, have less than, they cannot penetrate the filter as well because they have less mass. However, there is a shortage on these filtering face piece respirators and should be reserved for people in higher risk industries like healthcare. There are other types of respirators, such as full face or full rubber face piece respirators with those N95 filters on them. And the CDC is now recommending cloth face masks for people who must go out in public places and maybe within 6 feet of people. Just a side note, this recommendation is to prevent the person wearing the mask from continuing to spread it, since they have found that asymptomatic and pre-symptomatic people have been spreading it better than they originally believed. This does not actually prevent the wearer from contracting it. So let's talk a little bit more about respirators. Because respirators are inherently hazardous themselves, precautions are required before allowing employees to wear one at work. If you allow employees to wear respirators on a voluntary basis, whether you provide it or the employee does, you must develop a written respiratory protection program. If you already have one, ensure you include it in this new exposure in your program. If you need a template for a program, we of course have them, so just get in contact with us. You also need to conduct medical evaluations. You can complete these at most occupational medical facilities, but at this point, you'd be better to ask employees to complete the questionnaire online. 3M offers an online evaluation, and it's about $30 per evaluation, and it takes about 20 minutes. They offer it in English and Spanish. And then you have to train employees on the limits of the respirator and your respiratory protection program. Now, if you're providing N95 filtering face piece respirator on a voluntary basis, you don't need all of that. You only need to provide employees with basic hazard information, which is within the regulation, table 2. You just have to provide them with that information Again, we have a handout we can provide to you if you get in contact with us. If the respirators are required use, they require a little bit different written respiratory program. They also require a medical evaluation, training, and fit testing. Fit test kits are at most safety supply stores. Just a reminder, as a Farm Bureau member, you do receive a discount at Grainger, including free shipping, so you should be able to get that quickly and for free shipping. Okay, now we're gonna head back to Corwin and go over some of the myth busters that we've all heard out there.
Thank you, Dominique. Yes, probably most of you have heard some of these Mythbusters, and the World Health Organization has posted some of these Mythbusters for you to look at. So I really recommend that you share this with your employees to calm the nerves. We know how rumors go and the effect it has on people. So just going through here real quick. We've heard that if you're around 77 degrees or higher, that you can't get COVID. Exposing yourself to temperatures higher than that does not prevent COVID-19. So that is a myth. The new coronavirus can be transmitted in hot and humid climate. So if you're thinking of going to the Bahamas or something like that to get away from it, it can still be transmitted in those areas. Cold weather and snow cannot kill the new coronavirus. And drinking alcohol does not protect you from COVID-19. However, I'm not condoning drinking alcohol, but a drink now and then can hurt. Mosquitoes cannot transmit new coronavirus. There was some facts that came out about that. And then hot baths do not prevent COVID-19. However, a nice hot bath after a long day at work, stressful work, thinking about coronavirus, might feel pretty good. Ultraviolet disinfection lamps should not be used as a method of sterilization against coronavirus. These can actually cause some skin irritation. So if you're thinking about shining these on your hands, I would recommend don't do that. Thermal scanners, thermometers can identify people who have developed a fever, but it cannot detect people who are infected, but have not developed a fever. So some of these workers that may be infected, the first 3 or 4 days, they may not show a fever, but you got to think about how long they have been around another family member that may have been exposed. So you really need to screen your employees and make sure you ask the questions. Do you have a fever? Do you have a cough? Do you have trouble breathing? And think about that when they show up to work. And if they do, then you need to be sending them home. There is not a vaccine at this time to protect against. However, vaccination against other respiratory illness is highly recommended to protect your health. And there is no evidence that eating garlic or rinsing your nose with saline will protect against COVID-19. However, eating garlic may help in the physical distancing. If they smell garlic, maybe they're going to back up a few more steps. And then young people are susceptible to COVID. A lot of young people thought they were not susceptible to it, but that is a myth. And young people can get COVID-19. Summary. There is a new coronavirus that we know of now and causes coronavirus disease 2019, COVID-19. It spreads easily from droplets of infected people entering the mucous membranes of bystanders within 6 feet and beyond. So it is very important that we practice physical distancing. It has a relatively high fatality rate, which was shared earlier, and even a higher hospitalization rate. Employers should complete a risk assessment, and I highly recommend that you do that to identify high-risk areas at your work site, especially with the areas where you have concentrated workers. Prevention measures should be completed according to the hierarchy of controls that Dominique went through: physical distancing, engineering out the hazard, disinfecting, training, and then PPE. Ensure that the personal protective equipment does not create a new hazard. Are employees going to be comfortable wearing a tight-fitting respirator if that comes to be? As well as other items such as barriers that you may install. If you're installing these from the floor up, does it cause a tripping hazard, or are there sharp edges? So you'll need to take a look at that. There's a lot of misinformation available. Ensure you are getting your information from a reliable source. The World Health Organization has information from across the globe. The CDC is continually updating their website with most of up-to-date information, and the Washington Farm Bureau is hosting a page that gathers CDC and other official sources in one place. Here's some important contact information for you. Washington Department of Health, there's their phone number and their website. The CDC phone number, the Washington State Resource Center at coronavirus.wad.gov, and Washington State Department of Labor and Industries. And right now they are working on a agricultural fact sheet that we have made some comments on yesterday, and they are in the process of expediting that to get that out so you have some more tools that you can use at your work site. Lastly, the Washington Farm Bureau Safety Director contacts. There's the 4 safety directors, and if you need information, you can contact us either email or our phone numbers. You can also call our 800 number. It's 800-331-3276, and that will get to the appropriate people. And as Dominique said earlier, they are handouts. Hopefully you get a copy of those. If not, they'll be on our website. And I want to go through real quick. When you go to our website, the first page, the home page, it will have a coronavirus page there. You just click on that, and you can go to the federal resources, where you will find H2A info, U.S. Labor Workforce Control Prevention Assistance for Small Businesses. If you pull up the Washington State resources, you will find the DOSH, the Department of Occupational Safety and Health Hazard Alert, the Governor's Proclamation, and Employment Security info. If you go to Ag Business Resources, that is where you'll find our safety meeting, the OSHA Guide, Prevention and Control for Farms. And then if you go to Printable Resources, that is where you can find all the signs, posters, and notices that you can print out and put up at your workplace. And then we have our at-home resources, health info for signs and symptoms, and how to prepare at home and the steps to take. And then we have the general business resource. We have the small business assistance and as disaster loans. And then the last one there is COVID-19 tracking. It's got all the information from University of Washington and facts and numbers. So with that, we'll take this time if you have any questions.
Yeah, guys, this is Rick again. I've had a few questions pop in on the chat box, and I think, these are some of the tougher ones, and let's do our best to try and answer these for the group. While we may not have concrete answers, let's kind of try and brainstorm some solutions, because I think some of these can apply to the larger audience. So let's talk about, one question came in here. This has to do with, we know in ag and in food production and processing, even outdoors, there are times we have workers where the work dictates, let's say like on a planter, being pulled by a tractor, or on machinery out in the field, where you have workers literally knee to knee or elbow to shoulder to shoulder, or on a packing conveyor sorting line. Physical barriers are not feasible, can't erect those. What are things an employer should be considering to try and help protect the workers there?
So the two items there that come to mind would be that we would need to mask those people up so that they are not infecting their neighbors through breathing or any kind of coughing or anything like that. And then if there is areas on the planters or very close by that, again, sanitation, personal hygiene is continuously and frequently, you're going to be need to wash hands. And then areas where people are touching, then we're going to have to try to find ways that we can use some type of sanitation equipment and solutions to make sure that those are washed down on a frequent and continuous basis.
So what I hear you saying on the related to, while PPE is the last resort in this type of a case, PPE such as the N95 masks, respirators, and gloves could be considered a feasible control if you're not able to slow the line down, use less workers, have additional shifts, but you need to make sure that needs to be sort of a last resort. Correct, Corwin?
That is correct. And by doing those things there, that you want to make sure that you document why you're not able to do the social distancing or the physical distancing, and that would be part of your hazard assessment, and make sure that that is documented.
Okay. Other question here, and Dominique, you might want to unmute your mic. We've got a couple questions, one related to disinfectant, another related to N95 masks. Since we're on the PPE topic, let's talk about that. Knowing that society right now, across everywhere, there's a shortage of the N95 masks. Can they be used, reused? What's the lifetime of them? What are we thinking right now on that topic?
So if we're talking about the filtering face piece respirators, they are in high demand, and if we can, we should reserve those for the healthcare industry. However, they are like they can be treated like any other respirator. They can be reused. However, that goes off of the life expectancy of those depends on the environment that they're in. So if they are going to be working indoors or near people all the time, you probably want to discard them after every shift. If they are outdoors and get dirty, they might need to be disposed of even more frequently. If you are going to reuse them, make sure that you're storing them in a fashion that keeps them so they don't get contaminated. But you can treat those as other types of respirators.
Okay. And given CDC's guidance to go ahead and cover your face with anything, have we heard anything yet from DOSH if they're going to allow that as an acceptable, preventable type of temporary PPE right now? Do we know yet?
As of right now, that is not an employee protection method. Mainly, this is a method of protection so that the infected individual does not continue to spread it without knowing that they're spreading it. So
right now, that's just for the general public. However, if employees voluntarily wanted to use that, let's just say in their general walking around the business, there's nothing that would where the employer needs to prohibit them. But say that you would call that respiratory PPE, we don't have a definitive answer on that yet, correct?
Correct.
Okay.
We don't. And we can make that comment to DOSH now that they are putting together this fact sheet, and ask them if they're going to put something in there to address that.
Yeah, because with the shortage, it makes sense. You know, something in this instance seems better than nothing. Next question here related to sanitation. Again, short supply of EPA-approved disinfecting supplies, and there's a shortage in disinfectants in the supply chain. What can an employer do? Is there a DIY, do-it-yourself that people can put together Have you seen anything out there?
That is a good question, and that is actually a question we have into L&I currently. I would assume, so this is not anything backed up yet, but you should be able to use the bleach concentration that you usually do to help disinfect. One thing that they do, they have been telling people is that clean the area first, so get rid of any of the dirt or surface grime, and then actually go through and do the disinfecting with the product. So if you're going to clean, you might need to wipe down an area before you actually disinfect it.
Okay.
I'd like to add to that. I talked to an employer this morning, and they are using a teaspoon of bleach per gallon of water, and it sounded, the information I got from them was that they found that on the CDC website. So we will look at their website and see if that is on there.
Okay. And then lastly, to answer to I got 2 requests. People love to hear Jeff Lutz. No, sorry, folks, he's not going to be on this one because he did want to know when the alcohol drinking training was going to occur, and that is not part of this webinar.
Yeah.
Other than that, oh, here we go. Related to, we just got a comment on the mixing of bleach and whatnot. Just a friendly reminder from one of our attendees to please also remember you have to have an eye wash station available if you have people mixing bleach. Even if it's household bleach, it is considered a caustic chemical and can burn the eyes. So L&I requires you have an emergency eye wash available.
And the correct PPE when you're mixing that.
Correct. With that, I think that captures the gist of the questions. Those of you that we did not get to your questions, we'll make sure and get those responded back. With that, from the safety and health team at Farm Bureau, anything else you guys want to add?
Be well and be safe.
Okay, and with that, thank you to Dominique, Corwin, and Richard for presenting today. Again, this webinar was recorded. We'll try and get this up on our website, and be on the lookout for more information from us. Thank you, everyone. Again, be safe out there. We realize these are tough times, but we'll keep trying to be on the forefront of information for you. Thank you. Have a good day.